Hey, my name is Jed Meadows, and this is video 1 of 4. And in this video, we're going to be talking about COPD, or chronic obstructive pulmonary disease. So, first things first, what is COPD? So, COPD is, like I said, chronic obstructive pulmonary disease. It is a chronic inflammatory lung disease that causes obstructive airflow from the lungs. COPD is common, it is preventable and treatable. So, this disease is characterized by persistent respiratory symptoms and airflow limitations that is due to airways and/or alveolar abnormalities. This is usually caused by exposure to like noxious particles or gases, like smoking or chemical exposure. COPD may be punctuated by periods of acute worsening or of respiratory symptoms called exacerbations. And we'll be talking a lot about that in this video or in the videos to come. So causes. So what causes COPD? So the main cause for COPD is tobacco smoking. And that's not just in America, that is throughout the world. So in the developing world, COPD often occurs in people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes. So tobacco smoking is the most cause for like more like revolutionized industries and stuff like that. But in like the smaller parts of the world, like Africa and the underdeveloped and more poverty types of the world, it's in like when you've built your own house and you don't have the proper fuel to keep it warm, you don't have proper ventilation. That's what happens to those types of people. So uh, another couple of causes is indoor air pollution, occupational exposure, genetic factors, age and sex, socioeconomic status, and infections. So with indoor air pollution, like wood burning, biomass fuel for heating and cooking, or poorly ventilated working conditions. So I know my family all have, a bunch of us have like wood burning stoves. Well, if that's not ventilated correctly, it could result in COPD. Occupational exposures like organic or inorganic dust, chemical agents and fumes, pesticides. Genetic factors, which include hereditary deficiency of alpha 1, antitrypsin. Age and sex, females have a higher chance of developing COPD, which I thought was not, which I thought was funny. I guess interesting is what I'm going to say. Socioeconomic status, poverty, living in unhealthy conditions, indoor and outdoor pollutants, chronic bronchitis may increase the frequency of total and severe exacerbations. So just like we are talking in lower poverty areas, and they don't have the correct fueling or correct heating to their house or correct ventilation, they can end up with COPD. Infections. A history of childhood respiratory infections has been associated with reduced lung function and increased respiratory symptoms in the adult. Diagnosis and assessment. So the goals of COPD assessment are to determine the level of airflow and limitation, the impact of the disease on the patient's health status, and the risk of the future events. COPD should be considered in any patient who has dyspnea, chronic cough, or sputum production, a history of recurrent lower infections, and/or history of risk of exposure for the disease. So when we come to assessment now, spirometry is required to make the diagnosis. The presence of post-bronchodilator FEV1/FVC is less than 70. That confirms the presence of persistent airflow limitations. So when we had our PFTs, and I know at least I did, we had a lot of COPD patients, and we could see due to that value being less than 70 that would confirm the diagnosis of COPD. Now this is the key. All right, sorry, I was trying to get that to go up for you. This is key indicators for considering a diagnosis of COPD. So this is a little chart that I found on the internet. It says that dyspnea, that is, the dyspnea is progressive over time, characteristically worse than with exercise, and persistent. If they have a chronic cough, it may be intermittent and may be unproductive, or has recurrent wheezes. Chronic sputum production could be in any pattern of chronic sputum production may indicate COPD. Recurrent lower respiratory tract infections, which we talked about in the last slide. A history of risk factors. So we went over all the risk factors, talking about tobacco smoke being number one, and poorly ventilated homes or home cooking or heating, of course. Uh, Family history of COPD, for example, like low birth weights and childhood respiratory infections. We just went over that. Now, more assessment. So, the goals of COPD assessment are to determine the level of airflow limitation, its impact on the patient's health status, and the risk of future events, such as exacerbations, hospital admissions, or death. In order to determine the therapy in order to achieve these goals, COPD assessment must consider the following aspects of the disease separately. So, presence and severity of spirometry abnormalities, what you get from PFT and such, current nature and magnitude of patient symptoms, history of moderate and severe exacerbations, and presence of comorbidities. Now, this, I know it's a little blurry, but the classification of airflow limitation. So, this is the gold classification of airflow limitation. So, you've got the severities, you've got what their values are in FEV1 slash FVC, and then you got their FEV1. So so class one would be mild, and the FEV1 or FVC is all the same. So I won't go over those. It's all less than 0.7. Okay. And then your FEV1. So with mild, an FEV1 is greater than or equal to 80% predicted. Now, class two, which is moderate, your FEV slash FVC is the same, and then FEV1 is 50% or less or equal to 50% FEV1 or less than 80% predicted. Ooh. Okay. Now, class three, severe, which is 30%, less than 30% or equal to FEV1 or less than 50% predicted. And for class four, very severe, you would have FEV of less than 30% predicted. All right. Now, this is the CAT assessment for severity. Now, the CAT assessment for severity is like questions that you ask, and you would rate these questions on a scale of 0 to 5. Or you would have them rate these questions on a scale of 0 to 5. So, I am happy, I'm very happy would be, I'm very sad would be a 1. So, like, the lower the score, the worse. So, this is just some examples of questions for a CAT assessment. And that is it for my first video. Thank you.